I started my career as a military officer in Canada. Did almost 16 years in the Canadian Forces and then took early retirement, got my 20-year pension. And the primary reason that I left is because I got a job offer from Microsoft to lead their imaging engineering division. And when, back in those days, is the mid-1990s, when Microsoft offers you a job, you didn't say no. And this is back in the days when Microsoft was about 5,000 people. So it was a really fun time to work there. It was like doing your master's degree all over again because you could basically work on anything you love to work on, and they would encourage it. And that's the reason that after a couple of years later, we founded a small company you might have heard of called Expedia.com. It was born within Microsoft. It started off with a core group of about 8 of us, and then grew to almost 30 people before Bill came to us one day and said, you're making $100 million a year for us, but you're not our core business. We're going to spin you out. And we were all horrified because to leave Microsoft was just not thinkable. Turned out to be a good adventure. I spent nearly 15 years with Expedia, rising through the ranks to lead all of the back-end engineering. And that's when we started to really dabble with AI and AI in the travel space. I retired for the first time in 2012. I really thought I was going to retire. 3 weeks later, my wife kicked me out of the house and said, go find a real job because you're driving me nuts. And so I ended up building Groupon's travel business. I became the CTO for Hootsuite, took them from a small company to enterprise scale, and then finally ended up at EagleView, where we took that company from 400 million to 2.2 billion. And then I retired again for the second time, or third time if you count the military. And then that's when I started to work for my passion, and that is healthcare. I've been an EMT for over 20 years, and I had the opportunity to become the first data and analytics officer at Mayo Clinic. And that's where I got exposed to the real complexities of healthcare and how things were being done with data in such a bad way. I mean, very wasteful ways. I mean, if you think about what we do in healthcare, we take rich data in the form of clinical narratives and we distill it down to a bunch of codes, and we lose all of the other information. So then we deal with all of the codes to make decisions. Well, with the world of AI, we can now, especially with large language models, we can now preserve that information and create rich data sources for clinicians, patients, payers alike from that data. And that's why I decided to join Sach in IKS.